Epidemiologists play a vital role in protecting the health of populations and advancing global health security. They investigate disease outbreaks and proffer far-reaching measures at containing such outbreaks. COVID-19 went beyond as an outbreak to a global pandemic, which the world is still battling with, and the Pioneer World Field Epidemiology Day is providing the needed platform to advocate for increased investment in field epidemiology, training, research, and professionals. Indeed, the past year has brought unprecedented visibility to the work of field epidemiologists, now who work diligently at combating COVID-19 and its numerous variants that we have seen recently. Now, with this visibility notwithstanding, more understanding of the importance of field epidemiology is required to strengthen public health systems around the globe for better detection and response to disease outbreaks. The COVID-19 pandemic has demonstrated how diseases need no visas, of course, to visit countries. We've seen it happen around the world. Now, in a moment, we shall interrogate the roles and challenges of epidemiologists in today's world. Welcome to Nigeria Today. The platform is NTA News 24, reaching you from Abuja, Nigeria's capital. I am Muspat and Wahab. We'll be back in a moment with a guest. Thanks a lot for remaining with us. Now joining me to speak on epidemiologist and public health system is Dr. Isaac Egboja, a public health specialist. Thanks for joining us, Doctor.
You're welcome. Good evening.
All right, very good evening. We also have in the studio Dr. George Uzo Aga, Assistant Director and Field Epidemiologist at the Federal Ministry of Agriculture and Rural Development. Thanks a lot, Doctor.
Good evening, and good evening, Nigerians.
All right, it's good to have you. Now, I'm starting with you, Dr. George Uzo Aga. We've seen or we've heard about how crucial the roles of epidemiologists are during pandemic, and COVID-19 brought that out loud and clear. What precisely do epidemiologists do during pandemic? What functions do they have particularly?
Thank you very much. Please permit me, first of all, to acknowledge my director, the Chief Veterinary Officer of Nigeria, Dr. Laniran Alabi, on whose behalf I'm here tonight. Also appreciating the Permanent Secretary, Federal Ministry of Agriculture, Dr. Ernest Omakihe, for the opportunity afforded me to train.
We are aware of the opportunities they've given you. Let's go straight to you. Yeah.
On epidemiology, generally speaking, is a branch of public health that studies the distribution patterns and the determinants of the health-related events in specified populations, and the determinants of these diseases or health-related events wherever they occur. So to expatiate a little more, there are 5 critical questions to ask when it pertains to disease investigation. These are who, where, and when, and then how and why. So as I said, talking about the definition is the study of the distribution and determinants. So those questions talking about who, where, and when deals with the distribution. You want to find out who are involved, you want to find out to what extent this outbreak has spread, and so on. Then you go ahead and conduct further studies in order to determine, what has led to this outbreak. And that's why you're talking about the how and the why. So that's in a nutshell what epidemiology, and talking about the field epidemiology, of course, you know that we are dealing with the population.
All right.
Yeah, the clinician deals with individual patients, while the field epidemiologist deals with the population. So we go out there, it's just like the foot soldiers in the health sector, to detect, in fact, we prevent. If we are not able to prevent, we detect on time, and then we institute response to be able to control these outbreaks.
Okay, you've talked about the 5 Ws. We'll come back to that. But in the meantime, is epidemiology only concerned with human population? I'm still sticking with you, Dr. George.
Thank you for that question. As I said, I'm first of all a veterinarian and an entomologist before I became an epidemiologist. It may interest you to know that over 70% of infectious diseases in humans are of animal origin. And we thank God that over time, the health community all over the world have recognized that, and the issues of disease outbreaks are being attended to holistically. So in animals, like I said, there are some diseases that are transmissible from animals to humans. Those we call them zoonotic diseases. Of course, in Nigeria, as of now, where there's an ongoing outbreak of avian influenza. And whenever we go out on outbreak investigation and response activities, we go along with the human health counterparts. They collect samples from the farm attendants, while we also take samples from the animals in order to be sure. We send these samples to the laboratory and to be sure that humans are not affected. Of course, you know that these pathogens, they have a way of mutating. They can change from time to time, and you never can tell when they will develop capacity to infect human beings. So that's why there is this collaboration under the One Health platform for veterinarians, human medics, and the laboratorians to work together to fight the common enemy, which are these disease outbreaks.
All right, thank you very much, Dr. George Uzoga. Now, Dr. Igboja, we've been hearing about the importance of epidemiologists around the world, and that became very more loud when it became louder when we had this pandemic. Now, tell us, how do you rate the intervention by these people in this field?
Well, good evening again. I will rate them excellent. You recall, apart from the last pandemic, the coronavirus or COVID-19, we had Ebola some years back. And the reason why Ebola did not spread or affect Nigeria as badly as it could have was because of the effort made by health workers, especially those of them that are of the public health background and those of them that have interest in epidemiology. When we talk of epidemiology, we are talking about the causes, the study of the causes and the distribution of diseases or disease states or health states, and how they can be controlled or prevented. So in summary, I think that health workers have done very well, the epidemiologists have done very well, especially in relation to the recent epidemics that we've experienced in this country, for example, with cholera that is ongoing, with yellow fever that is ongoing, with coronavirus that is ongoing, and with endemic diseases like malaria, HIV, and others.
Thank you very much, Doctor. Now, I'm still going to follow up with that. Now, what roles are available for health department to use in responding to a disaster like we've seen in the case of the global pandemic, COVID-19?
Well, that is easily seen.
All right.
When we have cases of disease outbreaks, or when we have endemic diseases, one would want to know what are the causes of these diseases. Who is at risk? When do they occur? Is there a pattern? Can they be prevented? What are the agents responsible for these diseases? When you ask all these questions and you try to find out, for example, the ongoing cholera outbreak, you want to know what is responsible for the cholera? Where does it occur? Why does it occur? And who is at risk? And how can it be prevented? These were the kinds of curious questions that occurred in the 19th century. When cholera outbreak in Europe was terrible and it ravaged Europe, many people died. An epidemiologist by the name John Snow took it upon himself, investigated how it occurred, what caused it, and how it could be prevented. And that's how cholera was brought to control.
Okay, thank you very much, Dr. Egbuja. Now, Dr. Uzoaga, thanks for being with us. Now, Dr. Egbuja has told us how crucial the roles of epidemiologists are, now particularly in preventing the spread of diseases, in citing the example of cholera that we have at hand now in the country now. Is it only a reactive role that you play, or there's a way of detecting possible outbreak before they occur? Can it be prevented?
Thank you very much. Like he said, the role of field epidemiologists is, first of all, preventing. When that fails, they go ahead to detect timely. And then when they detect and the disease is there, then they respond to it. So there are a number of things that are being done, like we know about certain epidemic diseases that have plagued Nigeria, like the Lassa fever. And we know that by reason of epidemiological studies, it's been proven that it's the bush rat, the Mastomys natalensis,
right,
that is responsible. When it's infected, it shares the urine. And you see local people, they can spread their farm produce along the roadsides. And when this rat, the urine comes in contact with these food items, and the people eat them, they get infected. So we go ahead to sensitize the people, in these areas that have been prone to Lassa fever, like Edo State and Benue State and some other places. We go ahead periodically to institute sensitization programs. And again, there has been an upsurge, an increase in training programs.
all right,
You understand? Because we need more of these food soldiers. As I'm talking to you now, we have a program where we call ASAVET. The FAO, Food and Agriculture Organization of the United Nations, graciously this year reopened their office in Nigeria, the ECTAD, that is Emergency Center for Transboundary Animal Diseases, to build capacity, because we need to intensify surveillance, because there's what we call active and passive surveillance. So by active surveillance, you go out there to find out what is going on, concerning certain epidemic-prone diseases, so that we can find it on time and nip it in the bud. So to that extent, Nigeria is doing well. You already know about the FELTI program, that have built capacity, and that was how Nigeria was able to respond to the Ebola, problem in 2014. That even Americans were asking, how did we do it? So all of this is because of being proactive, and I think we are still doing that. The ASAVE program is ongoing. We are just I happen to be one of the trainers.
all right.
And this is the first cohort, and it's going to continue. It's a 4-month training.
Where is that taking place, by the way?
It's taking place in Abuja here.
All right.
So they are in the class.
Okay, you mentioned the Enlightenment program, or campaign that you have embarked upon. What has been the results that you've recorded from that?
It's quite impressive. Like in the animal health sector,
Yeah.
there's another disease they call African swine fever that ravaged the pig industry in 2020, leading to massive losses of up to 20 billion naira. So we have continued to train the farmers, in various centers, and they have, on biosecurity measures, the measure they need to adopt to prevent the occurrence of this outbreak, and they are complying. So with that, there has been a reduction in a number of other epidemic-prone diseases.
All right, thank you very much. Now, we will take a break on Nigeria Today. We'll continue in a moment with both of our guests in the studio to provide more insights. Thanks a lot for staying with us. We're still on Nigeria today discussing epidemiologists and public health system in Nigeria. And I have Dr. Isaac Egboja, public health specialist in the studio. Also Dr. George Uzaga, an assistant director and field epidemiologist at the Federal Ministry of Agriculture and Rural Development. Now, Dr. Egboja, we know how important data are, or when it has to do with pandemic or disease outbreak in any society. What is the importance of data now during disaster as we get them from epidemiologists?
Very important. By the way, when you talk of epidemiology, you are talking of the systematic, the data-driven study of the distribution and occurrence, causes, and method of prevention of diseases. So when you gather data, you are able to analyze the data and you are able to answer some of the questions: how diseases occur, when they occur, who is most at risk, and how they can be prevented.
As well as where.
As well as where. So when you don't have data, then you don't have any way of knowing who is most affected. Let me give some example. With the ongoing problems that we have, the COVID-19, you find that more adults are affected than young people. Why? Because young people have greater and better immunity than older people. And people with different kinds of diseases like diabetes, hypertension, cancer, HIV/AIDS, and so on, are more prone, more at risk. Whereas, when you look at cholera that is ongoing in Nigeria, young people, children are more affected. They die more easily than adults. Why? Because they get dehydrated easier. And they are more at risk because they are the people that are most exposed to the cholera bacteria, to the bacteria that causes cholera. So when you talk of data, it is critical, not just important, very critical. And we need to be keeping data. This is one of the problems that actually we have in Nigeria in all our systems, be it at local government level, state level, or federal level. We don't have enough data. Somebody would ask you, last time we had Ebola. After that we had Lassa fever. After that we had yellow fever. After that we had cholera. Now we had last year and up to now we have COVID-19. If somebody would ask you, for example, how many people were affected by each of these diseases, luckily you could see in the case of COVID-19, let me give that as a good example. Yeah. Records have been kept very well, extremely well, to the point where we know how many people are affected by day, not just by the whole of last year or some months of last year. We know by day how many people were new, how many cases were new, how many were ongoing, how many people died, how many people recovered.
NCDC has been doing a great job in that regard.
Yeah, and we're able to even stratify our data into states. And within states, we're able to know which local governments are more affected. If you listen to the reports from Lagos, for example, Lagos is very good at it. They always specify which parts of Lagos are more prone, are more involved, are more affected than the others. And here in Abuja, we have been hearing that too. So data is very, very critical.
Very, very critical indeed. Now, Dr. George, it's one thing to generate data and it's another to make very good use of it. Are we sufficiently harnessing our epidemiologists as a nation now?
Thank you for that question. Like I said before, Nigeria is not doing badly in terms of workforce development.
Okay.
Yeah, we have a number of training programs that are going on to, for people to be able to go and generate this data. And talking about data, there's something I just wanted to say. When you hear smokers are liable to die young, it's not just a careless statement. It's a statement that is an outcome of painstaking research, data gathering over time, to come out with that statement. So in Nigeria, effort is being made, to begin to utilize this data. And again, what we call political will, that our policymakers and politicians should be able to also listen to the epidemiologists when they give suggestions on what to do, because we are talking about population here. If things, the right steps are not taken, diseases are prone to continue to spread, and that is going to affect a lot of other things, socioeconomic situation of the country, and so on. So it's important that, and again, people that are in custody of data should be able to release them when the need arises. Because there are sometimes you see a student coming to ask for data, for analysis. They say, no, we don't have it, or what do you want to do with it? So data is not supposed to be a secret. It's meant to solve problems. So Nigeria is trying, but we need to do better on that.
All right, Nigeria is trying, but we need to do better. Now, let me quickly get from you, which will apparently be your closing remark, Dr. Egbuja. In what particular area do you want investment when it has to do with this field of epidemiology? Quickly.
I think we need to do more surveillance. We know of the diseases that are most common in our environment, but there are new ones coming. Surveillance means you are looking out for a problem that has not yet occurred. And epidemiologists are like detectives, a police detective looking for trouble, watching who is committing crime. He's not looking for who has necessarily committed crime. He's looking at who could, or who is a possible criminal, and how he could wait to catch that person as soon as the person starts committing the crime. So the more we are vigilant, the more we do surveillance, the more we study, the more we pay attention, and the more we reflect on what has happened before, and the lessons we learn from them, the better we will be. And I'm glad to say that at the moment, like the issue of record, for example, we are doing much better than we used to do. If you go to the FCT healthcare system, for example, they keep very good records of their patients, of the cases, of the lab, or whatever tests they do, and whatever they do for the patient. So it is easy for an epidemiologist to go there and study the pattern of diseases in a particular hospital or in a particular community.
Thank you very much. Now, as Nigeria joins the rest of the world and other global health partners in celebrating the invaluable role field epidemiologists that they play in the society, it's not out of place to salute those who have been at the forefront of responding to the COVID-19 pandemic and other diseases that we have in the country, and we hope to get out of them. That's the program Nigeria Today on NTA News 24. We'll say thank you to our guests for being on the program tonight, and that's Dr. George Uzoaga, Assistant Director and Field Epidemiologist at the Federal Ministry of Agriculture and Rural Development. Thanks a lot for your time.
Thank you.
Okay, we also have Dr. Isaac Egbuja, Public Health Specialist, who is a friend of the house. So we appreciate your time always.
My pleasure. Any day, anytime.
All right, Nigeria Today will return tomorrow, same time, 7:30 in the evening. Be part of it again.
Thank you.